Show. I'm Dr. Kasey Holland, the host of our show. The Made to Heal show dives deep into the hidden obstacles that keep people sick, stuck, and searching for answers. From chronic infections and viral reactivations to environmental toxins, burnout, emotional stress, and nervous system dysregulation, we explore the complex roots of illness that conventional medicine often overlooks. Through honest conversations, patient stories, and interviews with leading experts in functional and integrative medicine, you'll learn what it really takes to recover your energy, clarity, and vitality. This isn't another surface level health podcast. It's a journey into the real mechanisms of healing, empowerment, and transformation. Because you weren't made to just struggle, you were made to heal and thrive. Welcome back to the Made to Heal show. Today we have Dr. John Kim, PharmD, with us. Dr. John Kim is a dedicated functional medicine pharmacist with a passion for helping others find the root causes of their health challenges. After earning his doctorate in pharmacy from Rutgers University's Ernest Mario School of Pharmacy, he pursued further training in anti-aging and regenerative medicine to offer a more holistic approach to wellness. His personal health struggles in 2015 deepened his understanding of the complex nature of healing, inspiring him to explore both biomedical treatments and natural approaches. Through his work with families impacted by autism spectrum disorder and his recovery from chronic infections, Dr. Kim has developed a strong commitment to supporting others on their health journeys. As the founder of Kim Wellness, a virtual telewellness practice, he focuses on hormone balance, immune health, and gut function. Dr. Kim is also a respected speaker who shares his knowledge on functional medicine at national and international events, always to help others take control of their health. His approach to care is grounded in empathy, knowledge, and a deep belief in medical freedom. Thank you for joining us today, Dr. John. I am really looking forward to sharing your own health journey as well as your recent work in cell danger response and nervous system regulation.
Listen, thank you so much for inviting me. I'm always a fan of you and especially your content and as well as your invite here. And I know you invited me for the past naturopathic event. So it's always good to connect with you.
Yes, it's fun keeping in touch through social media and following your work. I want to share with others your health journey because your experience is profound, your healing is profound, and I know it greatly impacts the work that you do today. So can you start by sharing your health journey?
Yeah, absolutely. So I actually had a NSTEMI or heart attack back in 2015. I had an 80% blockage in my LAD. I was the youngest patient to get a stent put in at the Morristown Medical Center. And at age of 33 years old, I mean, that was a complete surprise for me. Didn't realize I was going to be having to have to deal with that issue. But there were a lot of troubling signs that was already going on in my body that I was completely ignoring. And then the second thing is not aware of what was going on. Even 6 months prior to the actual heart attack, I actually had done a lipid panel testing, and I thought I had extensive blood testing, showed to be quote unquote normal, but I was not feeling normal. And then end up in a hospital, getting a blood work done. My troponin level was less than 1, except for dealing with this chest pain, and then the sharp pain shooting down to my left arm, and it was like very periodic pulsing issue, the arm pain. And then even the cardiologist and as well as attending physician at the ER didn't believe that I was dealing with issue of heart attack. They thought I was dealing with pericarditis. So that's when they had done a echocardiogram. They found out that my lower ventricle was not pumping well. That's when they decided to go into the cath lab, and then I found they had an 85% blockage. So, complete shock. End up in an ICU unit for 3 days because I still end up having to deal with this, the symptoms I was dealing with. And then I got discharged, and end up back in my house, staring at a wall, completely dazed, wondering what's going on and how could I actually have prevented this? Am I going to have a secondary heart attack? And that's why I started to ask a lot of questions like, what can I do to prevent myself to having another heart attack? Is it because of family history? Is it something else? So my doctor, I don't know if you know Dr. Kristen Gedrick or not. She's very in the whole Lyme space and such, but she was my personal physician at that point in time. And she actually asked the right questions, like, are you dealing with tick-borne illness or something else? So we did a blood test after about a month in, And that's when I actually tested positive for high levels of Aspergillus IgG, IgM. And then when you also had a issue to a Bartonella infection, we did a IGENIX fish test, Mycoplasma pneumoniae, Epstein-Barr, heavy metals, and parasitic infections. So there was a lot of slew of problems there. So afterwards, it took about 2 years to clear up Bartonella infection along with mold. I was able to get my health back. Obviously, there was a lot of challenge going on, not only financially, but stress-wise, but also to kind of give me a pivot into really looking at root cause medicine much more differently. So when I had done my fellowship in functional medicine through A4M, one of the focal point that I always wanted to do was female hormones. But when you do female hormones, you can't just do hormones. You have to also looking at the entire the gut function, the nervous system. And I didn't really quite understand how that's all interrelated. And then having to go through my overall journey and recovery process that really understood what was going on. Really, the impactful understanding was that understanding about how cellular health is really impact in terms of determining how your health is going to be. So during that time, one of the key things that really made a pivot in my health was utilizing lipid membrane medicine, specifically phospholipids. So at that point in time, I did IVPC and then doing IV sodium phenylbutyrate. I do utilize those two means in oral form these days and still able to get great results and helping a lot of people. But that really made a humongous difference in just improving my brain fog, my energy level, but also actually help to regain my body back in order. So yeah, it's been already almost 11 years, right? And it's a blessing in terms of where I am at this point.
Yeah, I want to highlight just a couple things for people that might not have heard of IVPC, which is IV phosphatidylcholine. So basically, what's happening there is when you've gone through something like Dr. John did with so many toxins and infections, the cellular walls are made up of these phospholipids and they can be damaged. And so doing a phosphatidylcholine can help that heal. Just for people that are hearing that and wondering, whoa, I want to get I want to get some of those or I need those. And the other thing I want to ask you is you you talked about when you came home from the hospital and you're just, you're there at home and you're thinking about, oh, I got to prevent another heart attack, but you're also feeling awful. What do you think that was like for your nervous system? And how did you kind of stay grounded to where you could mentally keep moving forward? Because I think in healing, when there's an acute crisis like that, that's a really big piece of it. How did you believe, hey, I can heal from this. I can come back from this.
Be honest with you, I didn't.
Oh,
You
fair.
know, you're in that panic state and you can't even think about anything else except for, all right, what am I gonna eat that day? What medications they might need to take. And then the second part is, what had happened. Like just basically trying to really recollect. I already went to my doctor 6 months ago. He said everything was normal, everything was fine. How can I actually develop this condition at in this point in time? Is it family history? Is it and it's a rare point. It was impossible to actually have adults as young as 20, 30-year-olds actually having a heart attack. Not even that, I never even had a history of metabolic issues, and then having to develop an 85% blockage, that's really alarming, right? So now understanding the fact that there's stressors, not just by infections, but also leaky gut as a being a stressor, right? Neurotoxicity or neurohypervigilance state, right? That could be a stressor that goes on. So there was a lot of clues and my body screaming that there's a problem going on, but I really didn't understand how bad it was until having to go through my own journey. And I think people end up having to go through that same similar issue as well. So I call it the Humpty Dumpty effect, where if you're sitting on a wall, if a Humpty Dumpty is sitting on a wall, it's fine, right? He could make fun of people, he could scream and everything else, but at some point, something's going to come in and it's going to poke him on the side and it's going to flip over and his shell's going to crack. And that's how unstable we are as humans, just walking around doing our thing. And you just don't know at the extent of the damages, or at least the instability you actually have cellularly, that something comes in and triggers. And this oftentimes can actually lead in from COVID-19 infections that a lot of people dealing with nowadays. Could be Lyme infection that had a lot tick bite and then triggering that. It could be mold exposure. Even the mold exposure wise, that's something that I passionate about because obviously I had to go through that, but just overall learning and the complexity behind that and how it triggers the entirety of the entire immune response and nervous system dysregulation and cell membrane damage is just the fact that you don't really sense the fact that this is a danger. But as over time goes, this actually literally chomps away on your cellular resiliency and leading into a development of the problem. So when I see clients with this type of complex issues that come in, that they live with MCAS, low sensitivity issues, or unknown issue in terms of why they're still feeling ill, and when you end up having to ask the right questions and investigate, usually they had some type of existing problem they grew up with, or they actually had history of PTSD, especially childhood trauma is a big problem that we don't really look at, right? And how that leads into neuroexcitatory or at least neuroinflammation. And then when you're looking at the entirety of the nervous system dysfunction leading into the hypervigilance state, so the microglial priming, as well as a mast cell priming actually occurs. And these patients are in this flux of not able to calm themselves down. And then when they're trying to do multiple things in terms of detox, trying to support many ways in terms of their liver support or binders, everything starts to crumble down because the overall cellular foundation is not settled in. So they cannot go through the overall healing cycle that they're trying to do. And this whole notion of cell danger response comes in, mast cell activation comes in, right? Dysautonomia that you see nowadays a lot more after COVID-19, and including the COVID-19 vaccines that goes on. And this is a type of things that it comes into play. So for me, I just didn't even have any capacity at that point in time because I was so frazzled. And this is what usually a lot of people are after going through that issues. They just don't have the capacity to handle anything, you know? So, but great thing is that I had the people around me to ask the right questions and directed me to where to go. And again, that's really the blessing there. I didn't even know about what lipid membrane medicine was. I mean, learned about it during the fellowship training because I had, Dr. Patricia Kane coming in and talking about what lipid membrane medicine was, and they called it what the PK protocol. Now it is what lipid membrane replacement therapy is. But at that time, her husband, Dr. Ed Kane, was a founder of Body Bio supplement company. He's the one who actually looked at my red blood cell fatty acid analysis through Kennedy-Krieger and looking at the structural damage of the cell membrane, looking at some of the renegade fats along with fatty acid deficiencies, how the fluidity index of the cell membrane is comprised of, if there's any other lipid peroxisome that actually is happening at that point in time. And those are the intricacy part of the cell membrane that I learned from that, and then realizing that that is it. That really explains, right? Explains why some people are getting severely sick, and some people, even though they might get the same exposure to the problem, they're not as sick as much. So it's just the overall epigenetic changes that goes on, and then the life experiences and such.
Yeah, I think there's been a lot more awareness about the importance of nervous system regulation for healing, especially in the last few years, but it's human nature to just not connect how much that impacts us. And it's also really difficult for us to, I think, comprehend like how complex our cells are, and how when something happens to us, conventional medicine, we still have the cardiologist for heart problems, the endocrinologist for hormones, the gastroenterologist for IBS. But it's like everything is connected and we can't heal if we're constantly just focusing. Like if you had just seen your cardiologist and not gone and dug deeper or seen somebody that was connecting everything together, you probably wouldn't have the same outcome that you have now and be as healthy as you are now. We can't just focus on, this one thing, because we are complex beings and everything impacts everything, literally everything. So that stressful conversation that you had this morning is going to impact your inflammatory levels. Like we think it just It doesn't even just impact cortisol because cortisol impacts everything. Um, so this, I guess I would call it this neuroimmune connection, is really what you're highlighting there, and that cell danger response with that nervous system. So why don't you tell us what steps you start with patients when things are this complex, and when you assess, hey, this is somebody that is stuck in cell danger response. This is somebody that has nervous system regulation, maybe dysregulation, maybe they have past trauma, but they also have the toxins. What is the first step that you're taking with those patients to move them forward?
Yeah, absolutely. Love to share that. I mean, I made a lot of mistakes when I was actually started to see these clients. Obviously my story resonated with a lot of people. They're reaching out and trying to seek guidance and wondering why they're getting stuck. And I thought just doing some random functional testing, especially blood work could be one thing, but just looking at the urine mycotoxin testing or even organic acid or even stool analysis can be enough to really move the needle in improving the person's health. But some people do, majority of people do, but there's about at least 30% in my clinical practice where that's not the case at all. And those are the clients that are often mislabeled, misunderstood, or they're being completely gaslit, right? That there's just overall mental issues. There are a huge component, a mental component and emotional component to it, but you have to look at much deeper. So generally what I usually do from the get-go to see how that person's nervous system is responding is the fact that when I actually get on a call with them, when the first 5 minutes, I actually ask them to close their eyes and then visualize what their perfect health is going to be. And if they cannot even fathom to think about your perfect health, or this is the response that I sometimes get. I've been so sick so long time that I cannot even picture myself getting better. Then you cannot work with them a lot of times because that's going to cause a lot of mental blockade. Meaning, let's just say if we start to start supplementation, for instance, or certain protocols like lifestyle, especially. One of the things I really emphasize is the circadian rhythm. Those things are going to trigger them because why? It's an unfamiliar territory for the nervous system. The nervous system always resort back down to what is familiar. If the familiarity is an impossibility of getting healthier, it's really impossible to work on that. So what do we need to do? First, we need to really work on the past trauma issues, like why is that person actually getting triggered? So the first question, like I mentioned before, really visualizing what the perfect health is going to be, and then see what their primary goals are. Afterwards, looking at how their past childhood was, right? So childhood trauma issues. Did they grow up in a house that's been well taken care of? Are their parents been with them the whole time? Are they come in a broken home? Did they feel safe growing up in their household? Were they emotionally content and felt that their emotional needs were met growing up? And I see the pattern where, especially for women, when I find the fact that a female client coming in and they state that their mother was very absent in their life, oftentimes they actually have some type of autoimmune disease, especially Hashimoto's, which I see. And so is it the main trigger of it? No, it's not. But that enough of that particular nuance of being neglected causes that much of a neuroinflammation. I think there was a particular study looking at emotional neglect, and then they compared as much as far as a child going through a war zone, right? So a person's brain and the body cannot perceive whether they're a small stress or a large stress, nor does the brain cannot perceive whether they're with a physical stress, emotional stress, or mental stress. And so everything becomes a trigger point. And if a person actually grows up in a narcissistic environment, that's also, and also a parent that's very abusive or end up having to be where unpredictability comes in. Often case that was me, how I grew up. That's a issue where hypervigilance state can actually come into play as well. Sexual trauma, right? All those things. And then how does the environment now factors in? And the fact that that is the environment they grew up in. And then the other environmental factors, like have they been exposed to mold issues growing up, right? Were you constantly moving along all the time? Where did you grow up in? Which country, especially, right? So that also shifts into the microbiome changes. I had a client who was an Iraqi refugee, And then she was 12 years old when she moved here. At age of 17, started having rheumatoid arthritis issues. Why? Because of the fact that it could be exposure to mold, which happened to be the case, but also dietary changes. Why she says, ever since I came to the United States, age of 12 years old, my gut has never been the same because the overall gluten, right, exposure when she was growing up in Iraq versus what you're getting exposed to the United States is also different. But the fact that when you're living as a refugee, that high stress response going on during the war, especially, that triggers a lot of standpoint. So I do a lot of these questions and answers and trying to figure out what that's going to be. And then really looking at where is this person's nervous system standing, right? Or do they talk really fast? Are they very sound minded? Or, what are things that are constantly bother them? So you could ask a lot of questions and kind of what I do is I usually never to connect the dots within that scenario in terms of their environment and nervous system. And then we're looking at what's impacting their cellular health. But usually the environment nervous system, when there's a lack of safety going on, the cells, especially the mitochondria, in a hypervigilant state. And so it's going to lead into a lot of the phenomena of cell danger response that goes on. So that's how I work through the process. And then after that, asking the right questions or in the labs, and then connecting the dots again, and then have some kind of a lifestyle as well as a supplement protocol. But generally speaking, is how do I create safety and pay, making the client settled in and grounded so this way we could go through the healing cycle.
Yeah, I think this is really important because in a lot of medical settings, there is not even time to properly assess this or ask questions and learn about somebody's background. And that's why a lot of times, you know, blood work is relied on. And then if you're positive for this autoimmune condition, you're given this medication to help with your symptoms. But meanwhile, all of this is still going on. And if anything, it's still progressing. When things are out of balance or in dysfunction, the body will keep compensating because even when things seem really, really out of balance, the body is trying to return to homeostasis, but that can look like what we call disease. And so then we typically in conventional medicine, and I'm not saying that those medications aren't necessary at that time, right? Because sometimes we have to stabilize things, help with symptom support so that people can function. But all of this is going on underneath. And like with your patients, did anybody ask them what their childhood was like? Did anybody ask them if they possibly grew up with mold? And the other thing that I see happen in functional medicine, natural medicine too, is this root cause approach where there's this one root cause that's causing all your problems. And that also is misguided because, like you're talking, maybe the first thing that made somebody more susceptible was how they grew up, was a traumatic event, and then there was a toxin, and then there was something else. So we have, I call it, a bucket where we have our health bucket throughout our entire life, and we have to assess what all is in it. Typically, when we actually start to look at that is when it's overflowing because you have so many symptoms that you can't function anymore. Another thing that I see with this type of patient, especially in women, is that for most of their life, people think they're fine because they're really good at keeping going and just pushing through, white knuckling through. Some of these people are extremely successful. Like you wouldn't guess that they're dealing with fatigue or brain fog. They just push through it. I know for me, through naturopathic medical school, I was exhausted. And when I finally told people how exhausted I was, they were like, "Are you sure? Like you look fine. You're making it through school. Like I think you're just a little stressed." Like nobody really it was it wasn't intentional gaslighting, but it kind of
Yeah.
was. Nobody really said, "Oh, you should not be that tired. You should not be struggling that hard. It shouldn't be that hard to study." and nobody brought up mold or anything like that. So addressing that and acknowledging that. And I really like how you described just that mindset. So one exercise that I have had patients do is I have them write down on one side, and I learned this by at a chronic illness conference from Dr. Tom Moorcraft, and it was actually when I was trying to heal from long COVID and was struggling to see, like, hey, am I ever going to be able to climb a mountain again? This is really scary. But basically, you write down on one side of the sheet of paper, like your fear, like, I'm never going to get better. I'm going to be bedridden. I, whatever. And then on the opposite side of the paper, you write the opposite. You say, I am going to heal. I am going to climb a mountain again. And then on the opposite side, you read that to yourself each day or multiple times per day if you have to, if you start to have those thoughts to break out of that. And I can personally say that when I was at one of my biggest points of low in a health crisis, that was like when people say, well, what did you do? Like, what was the the medication, which I was on medication, I was on supplements, I was on like everything you can imagine. But the thing that shifted me and I started getting well was that mental shift. And so I want to highlight that because I think it's really difficult when you're sick to believe that believing that you're going to get well is actually so important. So, especially when there's all these therapies out there like, oh, well, can I just get IV ozone or high dose IV vitamin C or this or that? That's going to fix me. And you might need those. You might need those and they might be very helpful. But that mindset is what is going to get you through. And so I completely agree with what you're saying and appreciate it.
So what I call is the reserve capacity, right? If you're lacking the reserve capacity, that's when you end up having to deal with a lot of problems. So your analogy of the toxic bucket, for instance, overflowing. Well, if your reserve capacity is overflowing, you cannot handle that. That becomes a problem as well, right? So what I really emphasize is how do I create a increase in redox reaction when you're in your cells, so it's where you could get your body back in order. So to really address these things, what I had developed is a program called the ENCORE Method. It stands for environmental factor, nervous system regulation, cellular optimization, optimizing detox and organ support, rebalancing microbiome, enhancing resiliency. So if you look at the roadmap, it's a sequencing matter in terms of how do I create safety and unlocking that client and walking that through the overall healing cycle. So especially when people read out there, Dr. Robert Navio's work on cell danger response, the healing cycle is like, where is that person stuck in? Are they still in an innate immune response state? Are they in a proliferative, a low oxidative state? Or are they in a phase of healing and differential state where the person's completely stuck, right? But no one is actually in that 1, 2, 3 phase. They end up having to have a mixture of different things. So we have to redirect in terms of how I see a client. Lab is just to determine how that person is and really helping to understand the clinical nuances of that. But each of the things that we have to really do early on is, how is that person's environment looking like? How's that person's nervous system? Is a certain state of the cellular issue that you see, low state of brain fog and autoimmune issues? Those are all signs of a cellular dysfunction. How's that person's digestion? How's that person detoxing? Are they able to digest fat properly? Right? Is there fungal overgrowth? Any signs of fungal overgrowth? Maybe they have a white-coated tongue, for instance. That's an organ issue. And then bile support as well. We keep forgetting that bile is a signaling molecule, but also bile does a lot of things in terms of helping to detox. When it's that bile flow is stagnant, that could be a problem. That also deals with liver as well. And on top of supporting the kidneys, right? How do I support proper ways of to detox the kidneys? It's not about the binder. A lot of practitioners end up having to jump onto the binder bandwagon, deal with mold toxicity, for instance, instead of utilizing all the means in terms of like bioflavonoids and minerals to solubilize the mycotoxins and getting things out correctly, right? To lessen the intensity, also preventing lodging of these endotoxins the person's dealing with. And then how do I rebalance the microbiome? It's not about killing the thing, but also looking and understanding the hierarchical issues. So I generally go after the mold colonization first, right? Followed by either parasitic or it could be viral issues, followed by Lyme or all the bacterial issues, and then heavily working on the biofilm problem as well. Because if an underlying issue of energetic discharge are gone wrong, usually that's end up having to be dealing with biofilms anyway. So you have to tackle that right away. And then the last part is how do we create resiliency in the body, right? So that you could live your life again. I'm a speaking proof in terms of even though you might be ill at one point, you are able to get your life back. You are able to tolerate some of the food that you used to eat and live your life fully and enjoy your life. And oftentimes that's not really talked about. And just as what you mentioned about like writing things on a notebook in terms of seeing what's possible, that self-identity aspect of it, people end up having to identify self that they're sick constantly, right? I am sick. I am having mold issues. I am full of parasites. I mean, that's not the mindset they ever going to do, but that's the overall mindset work that needs to be come into play. So that when all those things are lined well, that's when I see powerful transformations in people's lives. So I had this one gal, she's just done with me, and she went through 15 different doctors dealing with Lyme, mold, and babesia issues, including Bartonella, and she was constantly reacting to everything. Right, nothing seems to doubt anything else. So one thing that I did specific with her is, and she also had trouble sleeping. One of the first things I told her was, I don't care if you slept 2 hours or 3 hours. You're waking up in the morning and you're going to go outside during the daybreak and then getting that infrared and sunlight in your eyes. Let's work on that and make sure you eat within 30 to 60 minutes. Getting the protein synthesis, but also getting that safety signal back in, right? Making sure you hydrate yourself, especially utilizing structural water devices and minerals as well. And working to really settle that danger response state and bring safety, and as well as utilizing heart coherency, especially heart math breathing technique was a very powerful way into shifting her nervous system dysregulation. And it was crazy. 6 to 8 weeks later, came back for a follow-up, and her face completely changed. You couldn't recognize the person anymore because she's not what she used to be. Cellularly, she completely changed. But one of the focal point that really made a difference, I even asked her, I was like, what are the three things that really made impact for you? Sunlight, nervous dysregulation, and more sunlight. So that overall aspect of circadian biology wise really helped to increase that redox potential and making the shift that the body has to go through. And that made a huge difference of how I see chronic illness. That it's not the fact that you deal with mold issues, it's that you have a low electrical membrane potential in the body due to the stress response state, right? And then, and what we're trying to do is to increase that potential so this way your body becomes more resilient to handle the stress response. But this comes in terms of EMF toxicity that we have to get rid of, including blue light issues. People keep forgetting, not knowing that blue light exposure that not only affects insulin response, but found that actually affects methylation process because of methionine pathway. So like that's the part that we need to do to help create a better ways into the metabolic and biochemical pathway. And that's where people end up having to see a huge improvement there. So that's how, I came up with the ENCORE method, working with, complex cases, and then also that change in terms of how I feel nowadays. Right? I didn't realize how much of a nervous system dysfunction and a childhood trauma led to what I developed as a heart attack. It's not the fact that mold was a small picture that came in, right? Mold basically came in and threw a kerosene on the fire. The fire already occurred because of the trauma issues. I had gone through a very narcissistic father, constantly end up having to be, look out in terms of when he's going to lash out and such. Huge issue. And I always had an indigestion heartburn growing up and never thought that was a problem until when I was in college. I had trouble sleeping. I end up having to finish a half a bottle of wine just to go to sleep. Constantly hooked on drinking Diet Coke just to study. And then it was more of a, ways in terms of performance lifestyle. Like I got to perform, I got to get a good grade and do all these things. And that's how I led my professional life as well. And then at some point, your body's going to break down. Body's going to break down. And that's when I went through a hardship of starting up a holistic pharmacy practice, having financial issues, getting dumped, right? Because I didn't have enough time to keep the relationship going, and then just everything just went down a spiral. So that's where the Humpty Dumpty effect came into play.
Yeah. One thing you mentioned was light, and we could do a whole episode or several episodes just on light.
Yep.
But I think, people think, oh, yeah, I need to get this on because I need vitamin D. And vitamin D it's been well, everybody knows like vitamin D levels need to be good by now, especially after going through COVID and everything. But I learned this the hard way when I was living in Alaska is when sunlight, there's the circadian rhythm piece, but there's also the when it's on your skin, it activates detox pathways and cellular regulation pathways. It's literally life-giving and healing. And when I was healing, it was freezing outside, but the sun was finally coming back. And so I would sit outside no matter what. And on those days that I had sunlight on my skin, how I felt compared to when I didn't was totally different. And that's something that I learned living there that I would have never really understood at that capacity of how important it is because I could feel it happening. But light in what you're saying is again, it's like nervous system regulation. We take it for granted. We think that's not going to be the thing that's really important, but it is. And then the other thing that I want to kind of close on is a lot of times when things like this happen, like your healing event led you to reflect on past things that were impacting you. And that can be really painful, like looking back at childhood, things like that. But what I've learned in some of these healing processes with patients and whatnot is that you don't just heal, that when you get through it, you come out stronger and you have this lesson that you've learned that you can share with others, like you're sharing today, and also become more resilient. And so I love that that's part of your program because when I work with patients too, I don't want them to just stop having their symptoms. I want them to walk away so that they know how to prevent that from ever happening and change the trajectory of their life so that they are more high functioning, more fulfilled in their life and reaching their full potential. And that's real health, right? That's where, and so I think part of healing is reaching a point where you've made peace with everything that has happened and you have taken things that you have learned and now you're helping other people with it. And that is when then also you mentioned self-identity. You have a new outlook on health, on how you live your day-to-day life. I know for me, I stopped being like, when can I add this back in? And now I'm like, I don't want that because it made me not feel well. Like, I don't want the things that, made me susceptible. I crave working out. Used to be like, oh my gosh, how am I going to get through workout? And now it's like, I'm excited to do my workout. And so I think it really says a lot that you can be that sick and you can come back and be not just healthy, but stronger. And that's when you've got resilience in. So I like to ask everybody, what is, if you had to leave just one or two things for people that you want them to hear today, what would those be?
I would like people to know that healing is never linear, right? It's always being, you know, erratic and such. But one of the things that I end up having to focus with my client is that you want to make 1% improvement in your health every single day. And when you do that, that compounds into your new version of you later on. So that is possible. It's a journey. You're not running a race at that point in time. So you also have to be very forgiving for yourself as well. And that sometimes it also reflects into self-loving at the same time. And so if you reflect back, even especially for you, Dr. Kasey, when we look back, we've achieved a lot. Right? We
Right.
also have to be very loving for ourselves, what we achieve. You got to be proud of ourselves as well. Yeah, the state of what we are could suck always, right? Everybody actually has some type of issue. But where we are at this point in time, and what kind of improvement am I making every single day really counts. It's just the process.
Wonderful. It has been great having you on the show. Thank you for joining us, Dr. Kim.
Yeah,
Where can
appreciate
we find you? What
it.
is your website?
Yeah, absolutely. My website is drjohnkim.com. Wealth of information there. If you want to learn a little more about my methodology of the ENCORE method, it will be fully there. I'm going to have a free assessment tool as well. So if you're wondering, why you're stuck in such, there are some free tools that you could definitely do. And soon enough, I'm going to be opening up a community setting. So if you are looking for mentorship and such, that will be definitely available for the entire community.
Excellent. And those links, we'll put them in the show notes. So if you're listening now, you can look below for those at the show notes. Thank you for joining us on this episode of the Made to Heal Show.